All right, so let's discuss a bit of that now and how government is communicating the intricacies of the pandemic to South Africans. I'm joined by Professor Mcebisi Ndletyana, who is a professor of political science at the University of Johannesburg via Skype. Prof, a very good evening to you. Thanks indeed for joining us here on The Full View. So government has been quite transparent in communicating about COVID-19, but I guess what's important is how that message is packaged. How do you think South Africans are receiving that message? There's a lot of science, but do we care?
I think people do care, especially when they get to see people they know or hear of people they know dying. So they obviously would want to avoid that and are willing to do anything to avoid that. But at the same time, the message that government provides should be a credible message. Because this is already a contentious thing. By having to do things that would ordinarily be good, but so naturally would want to contest them. So it's important that the information is credible. And the message is equally important. People don't really have trust in politicians. A lot has been happening in the last few years that has undermined people's trust in government and certain individuals. So it's important that you have credible explanation. It's important that the process that is followed to announce these things is equally credible, and the person that makes that announcement is also credible. So all these things are important in the believability of the messages that government gives. Otherwise, if all that happens, people will follow.
Prof, in that messaging, do we think that government has managed to communicate in particular to those at grassroots level? I'm not in particular worried about, some of us who are in the suburbia, but those in rural South Africa. Is the message getting through to them about how we should behave, what needs to be done in order to ensure that as a country we are successful in this fight against the COVID-19 virus?
Well, South Africa is a fairly sophisticated country, Cassandra. It's well developed. I think every house, if they don't have a TV, they certainly do have a radio. And this message has been communicated all over. So whoever doesn't know has chosen not to know. So the message has been very clear, how you cook your hands. And really, at some level, we have to so yes, the message is clearly communicated. And of course, there have been instances where the decision-making has been very poor. For instance, the thing about smoking. The president, for instance, at some point said the ban on smoking will be lifted. We have a minister coming later on with doing that. That was a decision. You don't have a president announcing a decision only for that decision to be walked back by a minister. That's terrible. So that then creates the impression that there's a certain element of arbitrariness, that these things are not well thought out. Because for the president to make that announcement, one assumes that he would have thought about it thoroughly. So for the minister to come back and say, no, that's not going to happen, there's a certain irrationality in that process.
Prof, and I want to talk exactly a bit about that because over the past few hours, there's obviously got to be some kind of unity amongst those who are seen to be at the forefront of the fight against COVID-19. We saw a scathing statement from the health minister addressing recent remarks made by Professor Glenda Gray on the lockdown. This is a challenging time, and there seems to be cracks amongst those that we look up to during the COVID-19 fight. Is this dissent or simple, robust engagement?
You would expect robust engagement among scientists. Well, that's what they do. Part of their job to pitch their arguments against each other, to test certain things. But you don't expect that disagreement to spill out on the public. Because these are people we look up to. They should provide the way. Especially at a time like this with the crisis. Any country calls upon its best brains to provide leadership. So you expect them to speak with a united voice because they want to provide a solid life for folks to put. So that was really unnecessary, especially that lady did. you don't do that at times like this, especially when it turns out that some of the things that we said were completely unfounded. She was correct, of course, to raise those things within, amongst them, but not to tell people about that, because it then undermines the entire credibility. And you don't need that.
So in the manner in which the health minister had responded, do you think you could kind of see facts versus what Professor Gray had said? Was it correct of the minister to respond in that particular manner, given that, of course, it was going to be viewed in exactly the light as which you're putting it through right now?
Well, she made her statements in public, and therefore she had to be responded to in public. Her statements undermine the credibility and integrity of individuals as if they were idiots. So anyone really a self-respecting individual would respond to that and do so publicly. She shouldn't have done that. And maybe she should have been explained initially that government does not have to implement your advice literally. Because government has to balance a whole lot of other things, right? When you advise them on health issues, but the health advice has implications for other things.
Yeah.
So they have to consider that multiple interests. So perhaps she forgot or she didn't know about that. Maybe she should have been explained on those things, but it was a bit unfortunate, completely unnecessary.
Yeah. I want to go back to the earlier point that you made, and ask a question about whether sometimes there is politics in some of the health decisions that are made. Perhaps you could shed some light better than we can on that. For example, if you look at the issue of the cigarette debate, which has gone on for the longest time.
You see, there are certain decisions here, I guess, those who take them have very good decisions for taking those decisions, but we don't know, right?
Yeah.
For instance, there were instances where people were not allowed to buy certain kinds of shoes, on open shoes or closed shoes, all those kinds of stuff.
Yeah.
So for someone listening to that message, it doesn't make sense. So it would be helpful for the authorities to explain why they took those decisions. Because from where I'm sitting, it doesn't really make sense under these conditions whether or not buys an open or closed shoe. So hence saying the process is important. Because ultimately, you need is moral authority. Those who take decisions must have moral authority. People must believe them. For them to be ministers alone, executive authority is not enough to get people to do things that they would otherwise not do. They need moral authority. Moral authority is given to lead. People have to feel that leaders are trustworthy, they're credible, and they care. If we believe all this, then we are willing to follow as they give us, because they have moral authority.
As South Africa is scheduled to move to lockdown level 3, what are some of the key aspects that the president would need to take into account? I see that we met with religious leaders, he's met with political parties, and of course would expect him to address the nation at some point about why there is a need for South Africa to relax some of the stringent lockdown measures that have been in place, so that certain parts of the economy can get back to work, versus also making sure that we don't head fast into the projections that some of these modelers have now put forward.
Christina, the truth is very important here, and the truth is not pretty. The point is that this is a crisis, and you will never get it perfectly. Right? In as much as we are worried about saving lives now, at the same time, you also have to think about saving the economy. Because after this health scare, people will still have to go out and work and get food that will sustain their life. So the president will never get it perfect. People will die. That much we need to care about.
Yeah.
It's a question of minimizing the number of deaths. So, and also because it's a crisis, there will be mistakes. So it also doesn't help to nitpick and whine about this or that.
Yeah.
Of course, we can ask questions, but we cannot be complaining about every little thing.
Yeah.
Certain things will be gotten wrong, but at some level, we must get an opportunity for authorities to explain why they did things the way they did.
Prof, I wish we had more time. Unfortunately, we're going to have to move on to other stories that we've been tracking throughout the day. Thank you very much indeed, always making time for the SABC. Prof Mcebisi Ndletyana, who's Professor of Political Science at the University of Johannesburg. And of course, talking a bit there about Prof Glenda Gray previously questioning why government decided not to take the advice of the MIC or engage readily with the experts. Let's take a short break here on The Full View. There's so much more coming up on the program here. And don't forget, shortly after 8 o'clock, we'll be speaking to Prof Karim. And of course, we'll hear from him about what government strategy is going forward, given that these projections have now been put forward. Stay tuned.